This is Crystal Fenn from MedPage Today. I'm talking with Javier Provencio of the Cleveland Clinic about a comparison of ulcer prophylaxis drugs in the ICU, presented here at the Society of Critical Care Medicine meeting. So, doctor, how common is it that there's a need for ulcer prophylaxis in patients in the ICU?
Well, it's been shown that stress ulcer prophylaxis in the ICU, particularly in patients who are on ventilators and who aren't being fed, is very important. So we strive in our intensive care unit to have 100% of our patients who are on ventilators or who have severe brain injuries in my ICU to be on stress ulcer prophylaxis of some sort.
And so this study showed that proton pump inhibitors were better than H2 blockers. What are the implications for practice?
Well, it's been a debate for a very long time since the proton pump inhibitors came into the market whether we should be using those instead of H2 blockers. They're more expensive, but they seem to prevent acid more effectively in long-term patients at home than do H2 blockers. In the ICU, we have some competing issues, and that is that the amount of time that it takes for the acid suppression with a PPI is longer than it is with an H2 blocker. So this type of a study, comparing them head-to-head, is quite important.
And how does this fit into the other evidence from other studies on the use of one type of prophylaxis or the other? Well,
the study was actually very important in the sense that it compared head-to-head patients with proton pump inhibitors and H2 blockers. It used patients who weren't being fed at the time and found that PPIs were more important in that patient population. There's other work, including a poster presentation here, that has shown that if patients are being fed early, that the effect of the proton pump inhibitor seems to equal that of an H2 blocker, losing that advantage.
So at this point, what can physicians have a clear? Is there a clear message for physicians at this point then, or is further study need to be done?
I think the good news for physicians is that both of these things seem to be equal in the large cohort of patients that have been studied. Even this study that shows a small improvement only showed an improvement in acid suppression and not in patient outcome. So I think that the good news for doctors is that either choice seems to be okay. To sort of look at the fine points between either of the drugs, I think that we're going to have to do more studies.
Well, thank you, Dr. Provencio. I'm Crystal Fenn, MedPage Today.